Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our weekly updates. Today is October the 14th, and we have pretty good news today. So the good news is that in the world, COVID appears to be slowing. Really throughout the world, there are no big hotspots in the world. Some places in Eastern Europe, the UK, are still seeing a little bit more disease than we'd like. And Mongolia, for whatever reason, is seeing a tremendous amount of disease. But other than that, the world appears to be pretty quiet with no hotspots in any of the continents of the world. In the US, we're still moderate amount of activity. It's quiet in California and on the East Coast, but we are seeing a fair amount of disease in the Mountain West and a lot of disease in Alaska. The national cases are down, hospitalizations are down, and deaths, I think, are now starting to come down after a long period of high death counts. But we're still averaging about 1,800 deaths a day. That's a lot of deaths. When we think of anything else that affects public health, accidents, other kinds of illnesses, even 10 or 15 deaths a day is a lot. So this is really still a very high death count. In Oregon, our cases and hospitalizations are down. We are seeing some deaths from August and September now starting to be recorded. In Oregon, it's pretty quiet on the western side, especially in Portland and Eugene. We're still seeing some disease in Douglas and Jackson-Josephine County. And we have disease up in Lynn and Polk counties. But Eastern Oregon is where most of the cases in Oregon is. But hospitalizations are down, and that's a good sign. In Douglas County, our cases are also coming down. We're at about 32 cases per 100,000 per day, a little bit above the state average and a little bit above the national average. But cases are considerably down from where they were just a month ago. We are still seeing a fairly high number of hospitalizations with over 40 Douglas County residents being in the hospital with COVID. Some are at Mercy and the others are at other hospitals in the state and in the region. We are still seeing some deaths, and we're at 240 total deaths now, about 150 deaths since the beginning of August. So really a very high number of deaths, but things do seem to be getting better. There is some good news. The good news is that the Regeneron treatments are now available in several places around town. The Regeneron has seemed to be pretty effective in preventing hospitalizations in people who got Regeneron because of their high risk. The other thing that we're seeing is the vaccines are incredibly effective. So when we look at our hospitalized cases, we're seeing only a few of all of those are in the hospital vaccinated, and the rest are unvaccinated. Similarly, when we look at our deaths, the risk of death is 10 times higher if you're not vaccinated. The risk of hospitalization at least 10 times higher for those who are not vaccinated. So we know that the vaccine works, and that the vaccine still seems to be effective, even though we're dealing with the Delta variant. The news today is that the FDA is meeting about boosters for the Moderna and the Pfizer. They're also going to talk today about mixing and matching vaccines. So if you started with one vaccine, can you get a booster of another? So we're excited to hear what they decide from that. In addition, the FDA is going to be considering vaccines for kids 5 to 11. And that'll be exciting because that will then be another big swath of people who can be vaccinated and can further decrease the risk of disease. There's no place in the world yet that's vaccinating kids 5 to 11, so this will be new ground broken, but there's no reason to think that the vaccine won't be safe and effective in this younger group. Actually, 5 to 11 is the best time to get vaccinated. Your body has such a great immune response at that age, and vaccines seem to be really safe and effective for kids at that age. So we're excited about moving vaccines to that school age group. The other thing that the FDA is going to be considering over these next few weeks is a new drug called molnupiravir. I think they make it hard to say on purpose. That's an antiviral drug made by the Merck company. And what that drug does is it decreases the risk of hospitalization by about 50%. It's an oral drug, so relatively easy to use. It would be twice a day for 5 days. And it does seem to be effective in reducing the risk of hospitalization. So what we're hoping is that the combination of more people being vaccinated, fewer cases of the disease, the availability of the Regeneron, and the availability of the molnupiravir will make it such that COVID is going to be much, much, much less of a threat. However, in Douglas County, we still have a lot of people who are unvaccinated, and those unvaccinated people do leave a group of people who could continue to get infected. So again, our number one strategy is vaccination. So today, I'd like to invite people from Oregon Health Authority and FEMA who will be joining us in Douglas County for a big vaccine event. So we have today Kassie Clarke, who's the Field Operations Director, and Timothy Hall, who's a Field Operations Lead. So tell us what you brought here to Douglas County. So Tim, it's pretty exciting.
Yeah, so we have a FEMA team here with about 25 individuals who are from all over the United States who have come here to help support our state and the various counties in helping people get vaccinated. So really making it accessible to people. From the main site, we can also do support missions out to smaller sites and really reach out to those individuals who may not come to the big city very often. They don't want to go to the big city, or they feel like, going to their doctor's office or going somewhere like that is just more of an ordeal than they want to do. So it's a drive-through facility. We do take walk-ups, but for the majority, it's drive-through. Come through from beginning to end. If you have no allergic reactions or anything like that, it's about 25 minutes to get registered, come in and get registered, get your vaccine, and then be observed for 15 minutes. Those who have had issues in the past with allergies, we ask them to wait 30 minutes for observation. And people respond really well. It's very quick and easy. We've done as many as 300 in a day in Jackson County, and I would love to see those numbers here in Douglas County.
Right. So our numbers have been smaller. So tell us where you're set up and what hours you're open.
So we are right next door to the Roseburg Public Library, right off of Diamond Lake and Fowler in the parking lot there. Our hours are 11 to 6 p.m. Although my staff gets here early enough that we have been routinely been getting people in at 10:30, and we get them in and out. So my staff are very eager to be part of the solution, and they are willing to really hop to when somebody pulls in early. We do not like to turn people away. The very first day, I had a lady arrive here at 8 in the morning. I had just gotten on site. I explained to her that we weren't open until 11, and she wanted to wait to get her Pfizer booster. And so she did. She pulled right in and waited, and she got her in and out before I think it hit 10:30. So, staff are really eager to be part of the solution for any of the counties they go to.
So that's great. So you mentioned that you had Pfizer. What other vaccines do you have, and what other services are you offering?
So we are offering all three of the COVID vaccines. So we have the Pfizer, first through third dose. We have Moderna for first and second dose. And we have the Johnson & Johnson for those who just want the one and done. We're also offering influenza shots. We're offering the quadrivent flu, and that's actually been pretty popular. It's probably been our most popular vaccine so far, averaging about 15 to 16 a day of just vaccines. So we're also offering PCR testing, so somebody could come down and get tested and get vaccinated. The PCR takes about 3 to 5 days, and it gets sent to a national laboratory, and then the results come back through. You get an email and you log back into your account to get your results. It's pretty quick and easy, and we've been using it since I believe November of last year.
And what's the cost for all of this?
Absolutely free. Although I
Really?
never like to say anything is free, but it is being provided by the federal government. So we all pay into that giant machine. So I encourage people to come down and take advantage of what Uncle Sam is offering right back at you.
Well, that's great. So let's go over the hours again. So you're 11 to 6 each day through the 22nd, although you're closed on Monday the 18th.
Correct. We are closed on Mondays. You have to have staff to have a little bit of downtime. I would work them 7 days a week, but Kassie says I can't.
All right. So let me ask Kassie then. So this is not the only event that's going to happen in Douglas County. Tell us about the event in Reedsport.
Yeah, we're excited to be in Reedsport. And Bob, you'll have to correct me because I don't have the dates right in front of me of when we're going to be there, but it'll be the same operation as Tim is describing. And we will have all 3 vaccines available. And we'll be providing flu and testing at that location as well. If you or Tim have the dates available, that'd be great to go ahead and communicate those. I'm sorry, I didn't have the Reedsport date in front of me.
That's the first week in November. It's going to be there. We're going to announce the final dates this week, but it'll be that first week in November. And that, again, can be for anybody in Reedsport or anybody in surrounding areas who wants to go there. So, Kassie, I know you've been very involved in getting these remote sites out. How many different sites in Oregon have you been able to go to?
So with our FEMA operations, this is our 4th unit that we've actually received from FEMA. So we had 3 units previously that started in Eastern Oregon, has been down in Jackson County and all over the state with the first 3 units. I feel like we did such a great job. They gave us 3 more. So this is the first of that second installment. And we're excited to be in Douglas County. There'll be a second separate unit that will be in Reedsport that will travel the southern coast, starting in Curry and moving all the way up through Lane County along the coast.
So cost and convenience shouldn't be an issue for people getting vaccine. So for those who haven't seen it, really is quite the slick setup. Timothy, maybe you could explain what the setup looks like.
Well, so you enter in through the parking lot and you turn right, and we have a registration tent with a lot of FEMA staff there. We can double up the lane, so we can take quite a few cars. And at that point, we'll ask you whether you're here for vaccine or testing, what kind of vaccine. There's some paperwork that we give you for the shot administration record. Have you pull forward, you fill that out, and then you pull on over to the vaccination tent where a medical person will then do a screening with you, go over any questions you might have. Once we determine that you're eligible for the vaccine and that all the questions have been answered appropriately, we then will administer whichever vaccine is required. It's the same with the flu. We've had a lot of people that have done both flu and COVID at the same time, which is completely understandable and appropriate. So I got a phone going off in the background. I don't know whose it is. For testing, once we determine it's testing, they just pull around the corner and we get them registered for testing. And testing, registration, and doing the test, it's a self-administered swab, so they don't have to, they're not getting it stuck all the way back into their brain. They insert it about an inch up into the nostril and swab it each nostril about 5 times, and then it gets packaged and it gets shipped off via FedEx.
Great. Well, if you drive by, you'll see a big yellow, looks like a tour bus. And so these guys, we consider them the rock stars of the vaccination effort. So they're like in their tour bus and doing it. It's really quite good. So Kassie, tell us about how vaccinations are going in Oregon overall.
Well, I think we're excited to see that there's a lot of uptake on the boosters, Dr. Dannenhoffer. I think we're still working hard to get first doses in and complete those series as well. We're getting ready to provide the vaccine, as you indicated, for kiddos as well. So I think we're gearing up here to be able to prepare to meet the need across the state. I think Oregon has done, I think, a pretty decent job, but definitely there are pockets of areas that are still of concern to us. And that's why we're very excited to be able to provide vaccination efforts throughout the state. We have provided over 1,000 events. Our team is a pretty tiny team, and we just started vaccinating in March. And so pretty proud of the efforts, and FEMA has been a huge contributor for that as well. So we're excited to be part of the solution.
And next week, our Tiger team, which is our smaller team, is going to join forces with you, and we're going to be offering vaccinations in other more remote areas. So I think we really had the vaccines out there. The other thing that we've seen over this last week is a very good study where they looked at healthcare insurers that have lots of data on what kind of illnesses you've had. So in this country, when you get sick, they submit a bill, and so they know who's been sick from what. And what they were able to do was look at people who had vaccines to see if there were any unexpected side effects. And the good news was they looked very carefully at hundreds of thousands of people, and we're unable to find any unexpected side effects. So that's more good news, that the side effects that we know about are important, but they're really quite uncommon, and the benefit of the vaccine is tremendous. You know, I tell you, 150 people have died since the beginning of August. We don't think we have any deaths related to the vaccine. So the safety and the effectiveness of the vaccine is great. So that's great. So we're so glad you guys are here. I hope you're enjoying Douglas County. The weather has been on and off, but it really is a pleasant place. Great. Any final comments from you guys?
Well, it is a pleasant place, and we appreciate partnering with you in Douglas County. I do have the dates in front of me for when we'll be in Reedsport. It is the 2nd through the 7th of November. It, again, is the same hours of 11 to 6, and we'll be at the Douglas County Courthouse Annex. So we appreciate your support there in Reedsport as well. And I hope everyone does come out and sees Tim at the site there at the Roseburg Public Library.
Well, Timothy, we'll give you the last word.
Sure. So one of the things I like to say, and I've said on other interviews that I've done, is that I love naysayers. So my background is in microbiology and virology, and I love to talk to people that have a naysayer approach towards that, and like to talk facts with them. And so I'd say anybody out there that wants to come down and have a conversation with me, my only requirement is I will listen to your point of view attentively, and as long as you listen to mine, and as long as we do that, it's a discussion and not an argument, and we can still agree to disagree and walk away, but at the same time, I love to have naysayers come down, and I have a pretty high success rate with convincing naysayers of the science and getting them vaccinated. So I stand by my record for that, and I would love to have people come down and engage in conversation, and learn more from somebody who's I'm just one of the cogs in the wheel for the whole vaccine process, but I have been studying it much longer than COVID's been around.
Well, that's great. Well, I think we can probably find you one or two naysayers here in Douglas County. Well, thank you both. Thank you both for joining us, and we'll do another COVID conversation next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thanks for joining us.